Let's talk knee pain for you that are runners and athletes and also non-runners. I'm going to start off by talking about runners and athletes that have, let's say, knee pain on one side. And then I'm going to get into people that have bilateral knee pain or singular knee pain that might be osteoarthritic and some things that we can do there. The reason for this is I've had several people come into me, brand new to me, with knee pain. And we've had some really good success, whether it be somebody with acute knee pain that's trying to train for the Boston Marathon, let's say, or a triathlete and so forth. And then we've had some great success with people that have had long-term knee problems with some things we want to do there. The first thing I always suggest is before you do anything on this video, get an appropriate consultation. If you're working with your primary care physician, an orthopedic, chiropractor, physical therapist, before you do anything here, get an appropriate evaluation. The reason for that is there's many important reasons for that. Is you want to make sure you're not dealing with something else. Or if I show you an exercise and you shouldn't be doing that because you actually have an injury or a tear that is not appropriate for these exercises, you might even have a smaller fracture that was undiagnosed and so forth. So get an appropriate evaluation. Learn about what the specific problem in your knee is before you do these things. And then if x-rays are appropriate, do that. You never know that there's a curveball in there. You might have a space-occupying bone lesion of some sort or bone growth. You might even have bone cancer that needs to be looked at and evaluated. Even if you think it's an acute injury, there could be a background problem in there that only became painful after some training, but there could be something else in there. So just be aware of that. That's much, much more rare, but just be aware. So get an appropriate evaluation first. Okay, so let's say you're like me and you have right knee pain, as I have. Let's call it a runner's knee. Now, runner's knee is not a specific diagnosis. It encompasses several problems in the knee, but let's call it runner's knee, usually a patellar or a kneecap problem, right? So, and I have that issue. I've had that issue for 20 years with my knee. So I have changed from only running into different activities, doing triathlons and so forth. So a lot of cross training has really helped me and extended my athletic career. So I have some knee problems. Most of the people that come to me have one knee that is an issue. And there's several things that we find out during my evaluation. Now, when I evaluate, I think of people not just as a knee, but as a full body connected to the knee. And what we do, and chiropractors and physical therapists that think the way that I do, they'll do a full evaluation top to bottom. As an example, a runner comes to me recently and says, I have a knee problem. And we're doing just the basic initial evaluation. I'm looking at his standing posture. Sure enough, he's short on one side, long on the other, like I am. I pointed that out. His foot was turned out like this compared to the other side. I'm very much exaggerating to show you, but the foot's turned out. I said, okay, there's a problem here, indicating that there's some imbalances between external rotators of the hip and the internal rotators, and or there's a structural problem in the pelvis that needs to be looked at, and or there's a lower back issue that's combining into this. So all of those things need to be checked, which we did. I want to just briefly tell you another story with a triathlete who came into me recently with a plaguing hamstring problem. Similar evaluation. I pointed out quickly to myself and him, I said, look at this, you've got a short leg going on, foot is turned out like this. He had already been to a ton of practitioners, and so he started running, just consciously running by keeping his foot more aligned, and he reported back to me, he says, it's already feeling better, I can't believe this is really great. By just being aware that his foot was deviating out, and now he just consciously brought it back in when he was running. Something as simple as that can help. With another runner I'm thinking about recently is we evaluated that short leg. We started lifting the short leg, which happened to be in the problem side. And by the way, the long leg side tends to have more pain than the short leg side. But anyway, we boosted up the short leg side, and that made a difference immediately. With another runner I'm thinking about, we saw that there was a big rotation in the pelvis, a big rotation here, or if I can show you from that side, a big rotation here. So we did some pelvis adjustments and lower back adjustments to start evening that out. Huge change in the knee. And that can make changes in other things too, including hip and foot and ankle and so forth. Okay, so back to this runner that I'm thinking about right now, is we noticed the foot turned out shorter on this side, and so we had some structural alignment issues that we need to take care of. Part of my evaluation was muscle strength. So we were testing muscle strength, and sure enough, on the side of the problem, we found that all muscle groups in the leg were weaker than the other side. Slightly, everything was appropriate, but you could clearly see this one was not firing like that one. So now we're dealing with a whole body global weakness scenario, which I've seen many times. So we're going to have him be doing several exercises more on that weaker side. Okay? It just so happens to be that that is his painful side. I've seen the opposite of that. I've seen somebody have knee pain on one side, but the other side is weaker. Okay, other side is weaker. Let's say knee pain on the right, lots of weakness on the left side. So we actually do lots of exercises on the left side, which brings more of a 50-50 work balance back into running, taking stress off the opposite knee. That's the problem side. Okay. Well, in this case, he had knee pain on the right, lots of weakness on that right side, giving him a lot of exercises on that side to increase the muscle work, effort, and also to increase the connection to the brain. So in his case, I determined that the left brain was snoozing, not taking care of the muscle firing on that right side, so we're doing all this activation here, and I'll get into that when I get into exercises. You see, so it's important to get that appropriate evaluation, and most of the people that I'm talking about had kneecap pain, front of the knee pain, whether it's right underneath the kneecap like a chondromalacia patella tendonitis, tendonitis to the patellar ligament or patellar tendon below the knee, usually stuff right in the front. Some of the things I'm going to be talking about can also be good for meniscus irritations, ligamentous sprain strains on the sides as well. Again, don't be doing any of these exercises until you get appropriate evaluation and clearance from your therapist, chiropractor, orthopedic, whoever you might be working with. Very important. Okay. If I find balance problems, so part of the situation in my evaluation is I look at balance. So I'll do balance tests. I'll test one side, the other side. I'll even do the upper body to determine where the balance issues are. In the case of this person I'm talking about, also had more instability on that weaker side and the painful side. So he's going to be doing balance work more on the affected side on that right side as well. So I'm getting into some of the treatments that I'm doing now. Part of the treatments might be if he's less balanced on that right side and stable on the left, I will give him a simple exercise like, well, why don't you stand on your right foot, like so, for 20 seconds, 30 seconds, okay? So he'll be standing like that with a slight bend in the knee, not locked, slight bend in the knee, activated spine, activated core, and he'll be doing this. When he gets good at that, he'll be going over near a wall, and he'll be having his hand there, and then he will progress to doing it with his eyes closed. Notice that I'm keeping my foot close to the floor in case I need to put it down. You just open up your eyes and do that. So he's doing some balance exercises on that weaker side. We can do a single leg deadlift. Now, a single leg deadlift is not necessarily for strength. I also use it for balance. So here's a single leg deadlift, and you can see I need it on my right side because my balance is not great. But this would be a single leg deadlift on my right side, okay? But I'm doing it in my case for a lot of balance work, not for strength, okay? And then coming back up like this. So it would not be weighted in the beginning. This would be a basic one, activating spine, activating core, and then coming back up. We can make it a little more challenging by putting the arms out to the front like this, and then coming back, and so forth. Now, he'll be doing them on both sides, but I might do a ratio of like 3 to 1, 3 on the right side, 1 on the left. And that's going to cause a lot of the stabilizing fibers all around the knee to work a little bit harder. Notice when I'm doing this single leg deadlift is I have the knee slightly bent. I'm a fan of that, keeping that knee slightly bent on that affected side. So, great little exercise to do. And again, a lot of us that are triathletes and runners and so forth, we're not doing stabilization exercises. We'll just go do that thing, that running thing or that cycling thing or whatever it might be, and not do these other things that require time. I made another suggestion to a runner recently. I said, your stabilization exercise work really well for your kneecap issue. Cut 5 minutes or 3 minutes off your run in the morning or in the evening and do these exercises first. Great little thing to do, okay? So a single leg deadlift is a great thing for a lot of people. Oftentimes when we find weakness, we tend to be quad dominant and backside muscle weak, including glutes and hamstrings. You'll hear that as a common theme. If you go on YouTube or whatever and watch shows, you can see a lot of people talking about glute exercises and hamstring exercises. I think those are very important. Let me show you a couple. So here's one of my favorites from a standpoint of doing the glutes is a single leg bridge. I've shown this on the show before. So let's say I'm working the right side here. I'm going to be using the heel, not the flat foot, using the heel. The heel is pretty far away from my body. One important key with a lot of this too is watch my right foot. Right foot coming out to the side. That's easy to do. We want to line that foot up, toes pointing straight up like so. Okay? And then when I lift, you can see how little I'm lifting up here. I'm not trying to do this because that can pinch people's lower backs. Not a good deal. Okay? So just lift up a little bit like this. If you're stronger, you keep your leg out to the front part of your body, putting more weight on that side of the teeter-totter. Lots of work for the glute and the hamstring. If you're not that strong yet, you bring your knee back like this, and that will be easier to do. Hold that for a period of time, maybe 5 seconds, 10 seconds, 20, 30, depending on what's going on. If instructed appropriately, you might take a break and do the other side. And in a lot of people's cases, I might do 2 or 3 to 1 on the weak or affected side. Okay? The tendency is if you're doing several of them, watch my feet now. The tendency is if you're doing several in a row, you might find that your heels will creep closer because it gets easier, right? So just check in every once in a while and make sure your heel is far away from your body to make it a little bit tougher. Now, because these are difficult to do, you might only do a couple of repetitions early on, but you can do 2 or 3 sets per day. So if you get a chance to do them during the day, that's fine. So you might not be able to do 3 minutes of these because it's just too much. But you scatter several of them throughout the day. Great things to do before your runs, cycles, workouts, whatever you might be doing, just to activate those muscles that need activation. Great glute exercise, somewhat hamstring, but more glutes. Well, here's another one that I've shown in the past. It is a single leg hamstring lift. Chair's not as good. Chair is not as good. A rolling chair is not as good. Use a solid chair, a gym piece of equipment, bench, whatever it might be. Ottoman if you're home. You're going to be bent at 90-90. 90 degrees here, 90 degrees here. Let's say I'm doing the right side. I push my heel, just like the other exercise. I push my heel and just lift myself up. But you can see how direct that is. That's a hamstring lift. This is almost all hamstring. So it's just a nice way to activate that hamstring. And again, it's not so much up and down as come up and hold and then relax. You might do several reps on this side, again, with an appropriate evaluation. If this side is the weak and affected side, then you might switch over here but do half as many on the strong side. And that's one thing that I do when I am working with somebody. It might be 2 to 1 or 3 to 1 more on the weak side. You can see how little I lift up to get the work done. Right now, plenty of work right in the hamstring, like so. Okay? So that's a single leg hamstring lift. Think of the variations now. So here's some variations that you can do here. And by the way, if need be, you can do a double leg bridge. But if you do a double leg bridge and it's just done bilaterally, let's say your strength is equal side to side, notice again how little I'm lifting up my pelvis off the floor to get activated. Again, I'm not doing this. Some people might do stuff like this. I am a fan of heels further away, only lifting up slightly. That will not pinch your lower back. Just a much nicer way of doing that, okay? I like the single leg better because it's more balance and more stabilization and much more difficult. So you can try those, okay? Here's some variations of this too. If you have a band, you can be doing a band, want me here? If you're doing a band at home, there are several ways you can do it. You can have a band with loops and have your foot through it. You can also have a single layered band and just tie one end and make a loop as well. So you can use looping ones like this, and you would have it to a fixed structure like so, and you can do a glute exercise if you're doing it at home, right? So you're doing it at extension with the band and doing it just like that. For some of us, what you're doing right now was enough. You're just lifting the weight of your leg. My foot is also, again, lined up straight. I'm not letting it turn outward. That's a key point, not letting it turn outward. I am going straight backward with core activation, spine activation. So I'm not doing it in here like this. Spine activation and core activation, and I'm coming straight back. When you move up to it, you can use a band for resistance in that direction. And if you're at a gym situation, oftentimes there are cable scenarios that you can wrap one of the attachments around your ankle, and it's to a light cable, and then you can do various of these. Once again, if you've had an appropriate evaluation, then you know that you can be working more on the weak side and the affected side than the strong side. Okay? You might need a little bit of support over time. Maybe you do it without support to work the balance systems, always activating spine and core while you're doing those exercises. Hamstring, you can do other alternative hamstring activities. You can have a gym situation where you're curling while standing, okay, like that. You can also do a band that's at an angle and do a hamstring lift like this. Not as much of a fan of the gym pieces of equipment that you're sitting and curling your hamstrings on both legs. We tend to do too much weight. It can irritate the lower back. I've seen problems like that, and can actually irritate an already irritated knee. I prefer these single leg ones done first, either with a band or a cable. I think they're much safer to do, and you're probably going to find them more effective. Okay? So there's a couple of simple exercises that you can do to get your knees back in shape. Now, spine work, I just want to mention, myself being a chiropractor, I have found great improvements by looking at the structure that I talked about. If there's a long or a short leg, maybe we need to lift that short leg if it's a true short leg, and oftentimes it is. So we'll work that and field test it. Some people respond in a positive way to a heel lift, some do not. We figure that out over time. In my office, I also have a cold laser. I use low-level laser therapy. If you want to look on this online, you'll see a variety of things. So the company, the laser that I have is from a company called Urconia. You can look up the research on low-level laser therapy, also called LLLT. You can also go to the urconia.com website and check out the research there. Now, what if you don't just have an injury or runner's knee like I'm talking about, but you now have an osteoarthritic degenerative knee? Okay? Here's a couple of other tricks that I've seen that have helped people. Omega-3 fatty acids from fish oil. I have a story that I told from at least 15 years ago. A friend of mine, a triathlete, very, very good athlete, and he's 10 years older than me and is much faster than I am. And so he had ongoing knee pain. He had osteoarthritis in his knee, and he just talked to me one time. He said, "What else can I do? I'm doing all this stuff." I said, "Have you tried omega-3 fish oil?" He says, "No." He started taking it. He writes me an email back. He said, "It's definitely helping. I can move better. It's more flexible," and so forth. I've done that with several people in my office as well, so look at that. Next thing is trying magnesium. I've done plenty of shows on magnesium so you can understand how magnesium can help the anti-inflammatory pathway, help your tissues heal, help relax muscles, and so forth. So definitely try the magnesium. The last, two other things. One is dehydration. If you are dehydrated, all cells in your body are adversely affected, whether they're muscle cells, cartilage cells, nerve cells, digestive system cells. It doesn't matter what it is. If you're chronically dehydrated, that will be a problem. So check your water intake. And the last thing that no one talks about for singular arthritic joints, or even both knees that might be arthritic, is your diet. Check your diet. If you're eating an inflammatory diet, you will have more pain. If you switch to a cleaner anti-inflammatory diet, you're going to do better. If you're an athlete, it's going to help you with athletics anyways. But if you're somebody with a degenerative osteoarthritic knee that's heading in the bad direction, or both knees, if you start to change that nutrition around, and you might not hear this from your other doctors, but I'm telling you, if you clean up your nutrition, your joints will get better. And I have seen this from some of the people that have done this. When they change their nutrition, their joint pains get better. So keep that in mind. And lastly, never give up. I've told the story many times of a woman now in her 80s. Her knee is terrible. It is almost bone on bone. And she's limping around, and her pain's 9/10. And she asked me if I could help. I said, I don't know, I can try. She already told me she needs a knee replacement. She probably does. We start working on her knee with a little bit of chiropractic work, a little bit of the tricks in here. And sure enough, her knee is a ton better. Now it's a level 2. She's walking much better. That was 10 years ago. She says, I don't need a knee replacement now. And I said, I don't blame you. So you never know. Sometimes some little simple things can really matter. I'm Dr. Scott Fuller. Join me again.